Thank you all for joining in. But before we begin, about the Alliance, the Manufacturing Safety Alliance of BC is a non-profit health and safety association serving the food and manufacturing industry in BC. We've been an organization for 13 years providing health and safety support with a vision to reduce injuries and the associated costs to build strong, sustainable business. We invite you to call on us for confidential help with your safety program in response to COVID-19 or any time to assist, and visit our website for safety training and resources or information on the Occupational Safety Standard of Excellence program, core certification for other sectors, enhanced for manufacturers and processors. Today's webinar will speak about what have manufacturing leaders in BC and abroad learned from the turbulent initial months of the COVID-19 pandemic about leadership, change management, and resilience. Knowing the importance of these critical components and how each set the stage for effective outcomes. Today, we've invited executives from 2 BC manufacturers and a third joining us all the way from Germany to share their insights. On our panel today, we welcome Nick Riak, Vice President of Operations at the Great Little Box Company in Burnaby. Great Little Box is an Occupational Safety Standard of Excellence certified award-winning manufacturer and distributor of custom and stock packaging solutions, highly regarded in BC as a best managed company and top employer. Nick has served Alliance members for several years on our board of directors. Joining Nick is Chris Inkster, President of West Kelowna-based Freeport Industries and OC certified custom manufacturer of modular structures for industrial, residential, and institutional use. The 2019 recipient of the Ben Hume Leadership Award, Chris also serves on the Alliance Board of Directors and is Vice Chair of the Executive Health and Safety Council of BC. And joining us all the way from Frankfurt, our third panelist is Gunnar Teut, HR Group Manager, Operations at Nestlé Deutschland, one of the largest food companies in Germany with nearly 10,000 employees, 6,500 of them in operations in 13 factories. Gunnar leads health management for all sites and the safety team at the company's Frankfurt headquarters. He also serves as deputy head of the COVID-19 crisis management team. For the first question, we're going to begin with how has the pandemic reshaped your company priorities? Starting with yourself, Nick.
Good morning, Lisa, and good morning, everybody. Well, I should say we are very grateful that the pandemic actually hasn't reshaped our priorities at all. That after the first 2 weeks of an initial crisis reaction to world events, we quickly got back onto our long-range plan and continued to execute, treating COVID with importance on the side, but not neglecting the priorities we'd established for the year. In fact, if anything, it reinforced our values as a company as opposed to our priorities. And our number one value is that everyone goes home safe and healthy every day. And this really put our money where our mouth was and showed our staff that we were equipped to respond to this crisis and do it effectively.
Thank you, Nick. Chris.
Sorry, Chris, your microphone needs to be unmuted.
Sorry. This pandemic has reshaped our priorities in a few ways. It's driven home the importance of making sure we have the right people in the right jobs. So culture is critical, and I would say that we had some people that were possibly in the wrong position, so we have made some efforts to refocus that, and I think that that'll be something that we'll pay a lot of attention to moving forward. It's also refocused our who we want to work with in terms of clientele, and it's also brought to light the need to invest in cross training. I would say that we definitely were weak in that regard, and that's put a big light on our our need to reinvest in making sure people can do multiple jobs.
Thank you, Chris. Very insightful. Gunnar.
Good morning to all of you. So for me, it's nearly the last meeting of the day. So reshaping the priorities, I think the overall value, priority, the purpose of Nestlé, which is enhancing quality of life and contributing to a healthier future, we did this. First of all, we did everything to keep our employees safe, healthy, and supported. And the next one was to support our communities by filling shelves, by filling the supply chain. Of course, we did not do the C product, which was necessary and could have been an option for marketing, but we did everything we need to do for the communities and for the people. Of course, we shaped short-term activities. We postponed all major projects. We restricted access to our sites. We just focused on the people and on the production of the main products.
Thank you very much, Gunnar. The next question speaks to walking us through some of the changes you've made to try to prevent the introduction and spread of the virus in your facilities. Starting first with yourself, Nick.
Well, we did a host of things. I do recall early on that we had a spectrum of staff. Some were totally freaked out, and everywhere they looked, they saw people coughing and sneezing, and they had lots of anxiety coming to work. And then we had other people who were still planning trips abroad and asking if they'd have to quarantine when they came back. Just very wide, diverse range of reactions to the early information about the pandemic. But we favored the person on the other extreme. The people who were the most anxious actually guided our changes. And in hindsight, at the time it looked like an overreaction, but I think in hindsight, we've gotten a lot of recognition from our staff for being very proactive. And I think that training came from our certification, taking things seriously, doing risk assessments. I think we identified over 30 unique changes in our facility, from temperature readings to daily screenings to door pulls that you can use with your feet, to separating different divisions, to separating different washrooms and eliminating high congestion areas like lunchrooms and bathrooms and things like that. And we've almost transformed our factory with many different innovations that the team came together and suggested, and our maintenance team helped to implement. So it's like night and day compared to if you'd walked into our facility 6 months ago.
Thank you very much, Nick. Yes, indeed, this pandemic has changed how we work and how we do business. Chris.
Some similar things. We've developed work from home policies and implemented that in an effort to reduce headcount in the operating facility and in our corporate office. You know, obviously we've got enhanced cleaning procedures, tool cleaning procedures that are shared, stockpiling of PPE, wash stations and social distancing, signage, workplace screenings, daily workplace screenings. So we have multiple job sites. So with quite a contingent of subcontractors, so we have forms that they fill out daily. Supplier and subcontractor communication protocols, telling them what our efforts are going to be, modified shipping and receiving protocols, restriction to customer facilities and or customers' homes, and of course, you know, limiting the amount of people in meeting rooms and lunchrooms.
Thank you, Chris. Certainly a different world than six months ago. Gunnar, all the way from Germany. I know you have some pictures to share with us.
Yes. I think we have the same different world compared to 6 months ago, and it sounds very familiar. So first of all, the situation in Germany at Nestlé, we have about those 10,000 employees. With this, we had 17 positive cases. All of those colleagues are recovered right now. We didn't have any new infections since the last 2 months within all our employees. All these infections came from outside, people coming back from holidays or having contact to medical staffs. As soon as we heard that they were abroad, that they were, I assume you didn't hear it, but we had some outbreaks in Austria, in Switzerland, and those people just being there for a weekend were sent to quarantine from us. We paid this quarantine for the employees just to make the other employees and the production safe. We did the same as Nick and Chris told. We restricted access to our facilities. We denied international business travel. Also, national business travel was suspended. We asked office-based employees to work from home. And I just prepared some slides with pictures, but I assume it will be the same as in your factories. And we started sometimes very, very quickly. So the first things might look a little bit just built home. So first of all, just some pictures of crisis management. You see the dates. It was in the beginning of March. Impossible to think about it today, sitting in an office like this. Just 6 days later, there were just 4 people in the same room. And on the 26th of March, you see the picture below with just 3 people in one of the big meeting rooms. And if you would take a picture from today, we would wear masks. So it changed a little bit how we did this. And Dale, if you just can continue. Just to show you, of course, you can't read it. It's from our McGuire factory in Lüdinghausen. We started showing them the employees' hygiene rules on the 11th of March. Then we explained them, don't go in the break rooms with too many people, sending out messages about, we're proud of you, thank you for being there. Then just a day later, we started about talking about social distancing, the same, explaining them again how to wash your hands, keeping distance and whatever. So that happened in just 2 weeks. And Dale, if you just continue, you see, and in my opinion, very, very important is just information to the employees via screens or just boards, just give them new information, what happens in the factory. We did this, and then continuing the slides. You see, for meeting rooms, we just signed the chairs and said, okay, that's the place where you're allowed to sit. And you see it from our KitKat factory in Hamburg here. Those people working on the line, there's a kind of macro loan between them just to separate them. They are wearing masks. Unthinkable a few weeks ago. Just continue, Dale. You see the locker rooms or even the washrooms and the toilets. We did everything to remind the employees to keep distance. Even on the lines when they are working, you see in the upper right corner. And you see the canteen, just reducing chairs. So there's just 1 chair at the table where before that were 4 people sitting. In the canteen where they get the food, also signs on the floor. And on the right side, it's just for smoker room, just the rule to be just with 2 people in there. Just some other impressions. I think it should look very familiar to you. You see the daily stand-up just with distance. We just made the best out of it. And also in the offices, this macro loan wall in between them. And it just was made in each factory very individual to fulfill their needs at all. And I think there's one last picture. Very, very important. That didn't change the factory, but those people in the home office, they're not traveling, no meetings, and only home office. You have to keep the team together. They miss their colleagues. And by the way, this was a factory HR managers doing an online wine tasting as a team event. It was a great thing.
Yeah.
And that changed as well. But before this, we met 5 or 6 times a year.
Wow. That is excellent, Gunnar. Really, really insightful looking at the visual impressions. Like you say, very similar, but looking at this as an additional opportunity with the wine tasting, really, really excellent, excellent ideas and creativity. Moving on to the next question. Nick and Chris, both of you are leaders in companies with OC certified safety programs, the Occupational Safety Standard of Excellence certification for manufacturing and food processing organizations. How has being certified impacted your ability to pivot and adapt and to build a culture of trust with your workforce? Nick.
Yeah, I think as your question alludes, the subtle benefit that you don't often realize when you go through the certification process is that you're building trust along the way. And when I think back to our journey, one of our key programs is that we assign these books, these safe slip books, to all of our employees, and it empowers them to record any safety issue that they feel is a risk, and it scores it appropriately. And since our OC certification, we've received over 1,000 safe slips from our employees and resolved over 90% of them. And so when this pandemic hit, there was a whole bunch of misinformation, and there was a need to communicate to people in new ways than we'd been able to in the past, with large groups now having to distribute information to smaller groups in a timely fashion. And I think all the infrastructure that we built with our OC certification to deploy information, and that it was trusted over the years as people saw their concerns get addressed and learned new information through our toolboxes each week, we became the source for people to go to get the facts. And you know, that's done more to build trust with our culture than anything we could have created ourselves. So when the crisis happens and when you're really tested, your values are tested and your priorities are tested. And I think having established that trust and that safety culture for the last number of years, we really benefited and we're able to respond very quickly and collaboratively with our teams.
Excellent. Thank you. Thank you, Nick. Chris, how about yourself?
I agree with a lot of what Nick said. I mean, by having the OC certification, we already had a foundation in place to be able to build on. So that's the thing, is that it's a process of continual improvement. It's not just the end of the journey when you get OC certified. So, you know, the elements of the audit, like commitment from leadership, understanding your gap analysis and how to bridge the gap between where you are and where you should be. Hyper communication. I mean, I would say that communication we've got a new understanding of communication now that we've been through this. You know, now we're doing daily management meetings with senior leadership, and lead hands are conducting their own daily meetings. And so communication's on a new level now for us. Of course, like Nick mentioned, the participation with the Joint Occupational Health and Safety Committee, you know, understanding workplace inspections and how that relates to this. Training, which I talked about earlier, is a massive opportunity for us. And then emergency preparedness. I mean, there's something to be added to the emergency preparedness now. We didn't have pandemics in our plans. So, but as it all relates to trust is earned, and it is, if without it, you know, you don't have a lot. So by having this history of having a safety management system in place, we've been building trust the whole way through. And we've had some missteps along the way, but as long as you're forthright and honest with people, I think, you know, you try to do the right thing at every turn, you'll maintain that trust. So I think we've been building it along the way, and those are the elements that I think that we benefited from.
Thank you, Chris and Nick, both recognizing and both alluding to and clarifying that communication being a critical ingredient for building trust with your people, and of which is an essential ingredient in the OC certification program. So thank you. Moving on to Gunnar, looking at Nestlé as an ISO certified organization, can you comment on how the preparation that went into earning your certification impacted your ability to respond to this crisis and build trust with your workforce?
It's very similar to the things Nick and Chris already told. I think it doesn't matter if it's an OC certification or an ISO certification. It's very good to have commitment from the top, to have very clear governance models, employees are used to working procedures, are used to rules, they know what risk assessments are, and that helps during this crisis. So I think this is just the foundation which Chris was talking about. Trust comes from behavior, comes from leadership, comes from the managers, from contact to the employees. And it was, for me, the trust during this crisis from the employees was just, they saw that we care. This is the base how to build trust with employees. Of course, the certification and the procedures help.
Thank you, Gunnar. Let's move on to talk about leadership, another really essential ingredient in supporting workers and in driving change throughout this global health and safety crisis. The role of leadership in building a resilient culture, what does that look like in your organization? And what has been the impact on people and productivity? Nick, starting with you.
But early on, when I would have some crisis calls with my networking groups that I belong to, I was appalled to hear that in some other organizations, staff were walking out or demanding hazard pay when it wasn't necessarily appropriate, or there's this us versus them mentality. And I recall it was so important for us as management to be present in the building, even when we were requesting that people work from home. But with our factory workers, they can't take the machine home and run it out of their living room. And I just recall how much it was valued that the leaders, the supervisors, were all committed to being on site as long as we had staff on site running machines. And again, back to that trust theme that we keep weaving into these answers, is that served us so well that people didn't feel abandoned, that office workers were treated differently than production workers. And through all of this, we've actually seen a surge just based on the markets that we're in, heavily into grocery and food and beverage, that our demands have gone up, and we've actually required our staff to come in and work overtime and produce more than ever in some cases. And having established that early, that supervisors and managers and leadership was communicating well and participating and on site every day as an essential service provider. I think that's how we reinforced our culture and kept our connection with our people and ensured our productivity standards were all at normal levels.
Excellent, Nick. Wow, what an impact. What a good place to be in this pandemic. Chris, how about yourself?
So I was on a BDC call yesterday with them and an organizational called Pathfinders. They're ex-military people, and they are actually talking about resiliency. And I just thought I'd throw this out there. They mentioned that resiliency is built and character is revealed. So I just thought that was a touching statement. But for us, when I was actually out of the country when this really ramped up, and I had to quarantine when I came home early, and I had to quarantine from my holiday. And so managing through this in the first 3 to 4 weeks from home or from out of the country was really, really tough. I mean, lots of people have had their challenges, but showing resiliency and character via Zoom is kind of hard to do. So I had to try to get my message out, by ramping up our communication and trying to be self-aware of my body language and my tone. And even though it was via Zoom, trying to keep that element of confidence without unnerving our people. And so self-awareness, I think, is a big one, and also just generally how you treat people. I mean, it's easy to lose sight of how to treat people, I think, in times of stress, and how you treat them through those really, really challenging times will dictate how you get through future challenges, because they'll either now distrust you or resent you or not even be there anymore. You may lose them altogether. So moving through a pandemic or a major crisis like this by soliciting feedback, treating people properly, and working together, I think helps us build resiliency and be prepared for the potential next uptick of this thing.
Thanks, Chris. Again, weaving in the trust into the importance of the conversation to enable workers to feel safe to come to work. Really, really good points. Gunnar.
That's what I said in the question before. The employees have to see that you care for them. This is the most important thing to build this culture. And for us, it's nearly the same as Nick said. We're talking about leadership, a very, very strong presence at the shop floor. It's not just being in the factory. It's not the factory manager being in his office. It's not the first line manager who is just somewhere doing admin tasks. It's just being with the people, being on the shop floor, and just explain them what we are doing. And by the way, every now and then, remember them to follow the rules. If it's about wearing masks, it's about safety, whatever. And next to this, safety leadership, behave as you want them to behave. And you need clear communication from C-level, from the top of the company, which goes to each and every employee. And then you can build on this trust, on this culture. And of course, resilience is very necessary. Even if you're in the crisis committee, you need much more resilience than everyone else. And the impact on people and productivity just during the last, let's say, 8 weeks, productivity went up in Germany in most of the factories, maybe even also because we just focused on A products. And our absence rate went down and the RER went down as well. Maybe because there were no visitors, no audits, no tasks multinational companies tend to do.
Thank you, Gunnar. Moving on to challenges, because we know there was a lot of different types of challenges that have occurred over the past few months. Where have you had your challenges in your response where you've had to change your approach? And how has your response to that challenge impacted employee engagement? So maybe starting with you, Nick, again. What are your thoughts to this question?
Well, the underlying challenge for us that's been there all along is how to balance the safety requirements of our staff with the economic responsibilities of the business. It's that classic yin and yang, but I think we've found a nice balance, and we've used a tool, the survey. So instead of trying to guess where our employee mindset was, we've repeatedly polled our staff, which is about 200 frontline workers, to see where their anxiety is, to see what they value, to see if they would like to have their temperature checked every day, or if that's intrusive, to see if they would like segregation of shifts and divisions, or if that's not necessary, to see if they need more kettles available to them or microwaves to make lunch more comfortable, given that their lunchroom facilities have been disrupted. So time and time again, we've gone back to the survey to take a pulse on our staff and understand what changes we need to make sure that they're comfortable to come to work, they feel safe, and that we can continue to run as a business and serve that other need that we have to keep people employed and to keep the business moving forward so that we're still strong at the end of this chapter.
Excellent, Nick. Survey engagement, really looking at understanding, the questions that workers have and then responding to them. Excellent. Chris, how about yourself?
So one of the challenges I had, and where I thought I needed to change direction, or my approach was, is I felt like I needed to be this unwavering pillar of control never never having a problem, and just, burying it until fake it till you make it kind of thing. And I was struggling with it. The stress of it all was starting to get to me. And I got a call. I was reviewing some of my town hall notes and my employee notices as we worked through this pandemic, and I got a timely call from an advisor, and he gave me some advice. So he said, you are not and this was relayed to him via somebody else, but you are not the company. Others are important to your company's success. It's not your job and your job alone. Lose the illusion of control, do what you can, and move forward. Failure does not cripple you. The perception of failure cripples you. So in one of my town halls, I was honest with them, and I just said, I am worried about making it, and not only from a business perspective, but in the eyes of my family, my friends, my peers. So, it was hard to admit that. Surround yourself with people you can trust, and invest in mental well-being, so your own and others. So those are the things that it was really timely to get that advice, and I think it's solid advice to listen to as you move through something like this.
Thank you, Chris. A really important part. As leaders, we're human and have the same vulnerabilities of to stress and the challenges that this pandemic has placed on all of us. Thank you, Gunnar.
Again, very similar. So I could talk about a lot of challenges we had during this crisis, because sometimes it was every hour that we had to change our thoughts and minds. We were talking about masks, when to wear mask, which mask. Is this KN95 or FFP2, or is it just the surgical mask, and who has to wear it, only external or internal? And there were challenges just in doing it. And the challenge in the crisis management was just coping with all those experts around you. Starting in March, everybody knew everything about a virus. Everybody knew everything about how it spreads. Then everybody knows anything about masks. The next one knows everything about temperature checks. And then there is a CEO or whatever who says, I have another idea. And you just have to get them together, kind of, and just to calm them down, and to try to get a lot of information and communication to the employees. And for our company, probably because it was HR-led, also to the HR community. We have a very big HR community, which are asked from the people, and just to give them the information and just tell them, okay, just 2 hours ago, I had to tell you this, and now we have to change it, whatever. And I think it was to manage the change.
Excellent information, Gunnar. I mean, knowing the overwhelming amount of information and how do we segment that effectively to really make decisions, a really big and continues to be a challenge. Thank you. The next question focuses on contingencies. So Dr. Bonnie Henry in BC, which is the Chief Medical Officer, talks about preparing for a second wave. So starting with you, Nick, what contingency plans have you made for the next 6 to 18 months? And what do you see as the most important steps or considerations in contingency planning for sustainable operation through these times?
Our last toolbox talk was about crisis fatigue. I think we're three or 4 months in, and people are starting to lose some patience as their lives have been disrupted and vacation plans, and they are yearning to get back to a new normal or a normalcy. So we have to keep being diligent, and a lot of our planning in the 6 to 8 months is to keep amping up our commitment and our diligence in preparation for what could be a second wave. So for example, we've drafted a pandemic response plan that's very formal, that matches different changes we'll make here as an organization in line with government regulations and advice, depending on where they say society is in terms of those phases. We're looking to get secondary cleaning vendors in so that we're not reliant on one vendor to keep being diligent with extra cleaning on high touch points and disinfection. We are upgrading our IT so that we're even more capable of remote work and continue to improve speeds and performance. And buying masks. So we're at that point where masks were very difficult and PPE during the initial wave, and that could happen again if things change dramatically. And so in preparation for that inevitability, we're stocking up on those key elements today, even though they may or may not be required in the future. So those are some of the highlights of how we're planning for the future.
Excellent, Nick. You know, preparation and communication on what might potentially happen. Really, really good, good feedback and information. Chris, how about yourself?
So we are at one point, our purchasing manager described our supply chain as being broken. So we're going to focus on based on our order file and product mix moving forward. We're going to focus on aligning ourselves with suppliers that can maintain our supply chain. So supplier screening, we're going to carry some unique inventory to allow us to finish our projects on time that are considered long lead and harder to get. We're going to, as stated earlier, we're going to continue to focus on cross-training employees, because if one goes down and we can't fill that position, then we need to. So we're working on understanding that. Like Nick said, professional cleaning services, we've got a third party lined up to do deep cleaning, disinfectant fogging, vehicle fogging, and air scrubbing should we require it if we have a positive case at our workplaces. And then conducting an audit on, on what has gone well, what hasn't gone well, and putting a plan in place to, to capitalize on that information moving forward, so we can address what's worked and what's not worked.
Excellent, Chris. Planning, preparation, communication, all excellent, excellent points for supporting your team. Gunnar.
It's the same. So it's continue most of the things we did. So, for example, we are still banning international travels. We are still limiting national travels. We restrict access to our sites, at least to our factories, as we did it during the last months. By the way, we're keeping stocks of masks as well, because we know how difficult they are. If you have something like 10,000 employees using 4 masks a day, you need a kind of stock per month. But really it's about keeping up the communication, make the people or the employees feel good and safe in the factory, and remember them to stick to the rules. It's the most important thing we have to do during the next months. Just as an example from Germany, here's one slaughterhouse employing something like 7,000 employees, supplying 20% of the meat in Germany. And they have something like 1,500 cases after a long weekend. And the entire county is just locked down again. And we use this, of course, as an example, just to say our employees keep safe, stay healthy, and keep the rules, even in your private life. Of course, we can't tell them what to do in private, but we just can show them what happens. And that's the most important thing if you talk about contingency. Make your employees safe and show presence on the shop floor once again.
Excellent. Really looking at a recurring theme of lead by example and communication and then follow up. I mean, really, excellent, but important components. Now really looking at the long-term impact, because there will be a time when the pandemic will be over, and looking forward to that for sure. But what do you believe the long-term impact of the pandemic will be on business and industry and on workplace health and safety, both in Canada and globally? Nick, starting with you.
Wow, this is a fun question. I think lots of people hypothesize about what changes may or may not happen. I don't know that I have a better crystal ball than anybody else. I think on a micro level, how companies have dealt with this will have an impact on their long-term culture. And so if they've missed this as an opportunity to show leadership and establish trust, then that's going to hurt those companies well into the future. And if you've done the opposite, then you'll benefit from that. More on a macro level, there's actually an interesting article in the New York Times today, if anyone's interested. They surveyed over 500 epidemiologists and asked them when they thought certain normalcy would come back. And based on that poll, there's a wide range, but the majority of them felt that we'd be back to normal in a year, for whatever that's worth. But I think personally, I think our company thinks there'll be an impact on food safety, that people are now a little bit more attuned to these kinds of things. The word pandemic, everybody knew what it meant, but hadn't ever experienced one. And so now I think people understand that their supply chain is important, that customs like shaking hands, as trivial as that may be, may go away. But as a manufacturer that supports the food industry, we expect to elevate our standards along those lines, that society will probably have a higher expectation.
Excellent, Nick. Really echoing the importance of leadership and driving culture change that is sustainable. Really exceptional, comments on what the future may hold, and important. Chris, how about yourself?
Yeah, we don't deal with international business, but from our world, I think you're going to see a continued uptick in the embrace of technology. I think there's going to be the need for flexible and innovative HR policies. I think that enhanced cleaning is here to stay. A couple years ago, we got hit really bad with the flu. We had our whole annual attendance allowance eaten up in 1 month. So I think enhanced cleaning is here to stay. I think generally speaking, we need to increase the level of empathy. As leaders, we're looking at, looked at to have all the answers at times, and we don't, or we look to other leaders for answers, and we're all learning. So I think we need to be patient and increase our level of empathy, because people are trying their best. I think we really need to invest in relationships, interpersonal relationships in our businesses. Purpose and connection, protect against stress, and we're going to have to invest in health and wellness. And I don't have a roadmap for that, but that's something that I think, particularly mental health, we're going to have to really focus on moving forward.
Excellent, Chris. Absolutely. The importance of mental health, the importance of empathy, in leadership and making decisions that demonstrate that, all critical parameters for effective leadership. Gunnar.
So the long-term impact, I think this back to normal won't be anymore. There will be a new normal, and we will see how it is. I think we got an impressive lecture on change management during the last months. It was just things were possible which really were unthinkable a few weeks ago. So we were discussing with tax department and those clerks doing the bookkeeping and how to pay bills or whatever. Before a few weeks, we need a handwritten signature on the sheet of paper, and now everything is digital and it works. And people doing home office were said, oh, it's impossible to do my job from home. And we have to see how it evolves. And we have to find the moment when we, for example, those home office guys, not the production or frontline workers, it's quite difficult, but seeing the headquarter here in Frankfurt, having something like 2,000 people, what do we do now? Do we say, okay, now you did a great job, but now you have to come back? Or do we say, okay, we just reduce the number of office spaces here and just stay in your home office? It worked out. And I think we have to see how it works. And I agree to Nick and Chris, things like more cleaning, like no more handshakes or no hugs or kisses or whatever should remain. Because probably people saw that it's good for them because there was no coughing or sneezing or whatever. So as our absence rate really went down. And I hope our leaders or first line managers and factory managers just remember this leadership thing, the shop floor thing, because it really was good. So I think this is a long-term impact.
Thank you, Gunnar. No, absolutely. How many of those good habits will stick with us to certainly, prevent any other health-related absences? A really important conclusion. So I'd like to thank you all for sharing your experiences and what you've learned in these turbulent times. We have some questions beginning to come in from the audience. To all of you, if you have questions, please submit them through the chat window while we have our panelists here with us. And if you'd like help with your own COVID-19 safety plan or any other health and safety concerns, please call us here at the Alliance to talk with a health and safety advisor. We are continuing to contact all of our member companies to check in, take advantage of our support to keep your people safe. So to start with the Q&A, what would you say has been the most valuable lesson you've learned throughout the pandemic as an individual and as an organization? Starting with yourself, Nick.
Well, I have to make an admission here that in February, I recall our Vice President of Finance saying we should buy a skid of masks. And I thought, oh, that's silly. What are we going to do with a skid of masks a year or two later? They're just going to sit there and all this money tied up in this masks. And then lo and behold, it was only 2 or 3 weeks later that everything changed and it became obvious what was required and all these changes moving forward. And I think I alluded to it in a previous answer, but I'm so proud of our team that sort of assembled on an ad hoc basis, people who are interested in making the changes we needed to make and respond to this challenge, that we responded to the person who had the most anxiety in the company. So instead of picking the average person or the person who is least concerned and watering down our approach, taking the easy route, we really catered to that person who felt the least safe coming to work. And that has served us the most during this in terms of recognition. And I think Gunnar referenced it as that feeling of caring for your employees. That came from catering to the person who felt the least safe. And moving forward, if there is to be a second wave or something of that effect, then I think responding forcefully and to a great magnitude is the lesson that I'm personally taking away, that these are very serious and that every employee needs to be accounted for, even if their views seem extreme at the time.
Thank you, Nick. Bringing everyone forward, including the most vulnerable, a really act of leadership. Thank you. Chris.
I just think that having some flexibility, flexibility and clear and concise communication, I think that's what really, we tried to get as much information out as quickly as we could. Like Nick said earlier, they became the source for facts. And I don't know if I was distributing facts all the time, but I was sure trying. And our employees really appreciated it. I received multiple, people providing feedback on their thanks for just doing our best to keep them up to speed. And then just being honest. If you don't know, you don't know. But you got to try to find out. So trying to get that timely and accurate communication out and being honest about it, I think, are the lessons that I'm taking away.
Excellent. Yeah, no, absolutely a consistent theme that we're hearing. Gunnar.
So most important takeaway for me is just managing the crisis from headquarters. It's just about communication is key. You can't over communicate. Just keep your employees informed, keep all the line managers informed, and if they just don't know how to handle the crisis, some individual cases, just be with them, communicate, and help them to show leadership at the front line. Next one is just make the employees feel safe. if the factory is a place where they feel better than when they do shopping outside, I think we did it right. And that's the most important two things.
Absolutely. No, certainly making sure that the environment is safe for workers to feel safe coming to. Incredible, important points. So another question from the audience, and this is from Maureen Shaw. She's known, at least from her historical wealth of knowledge in health and safety, the mother of health and safety here in Canada. Welcome to our colleague from Germany, and thank you. Please give my best to dear friend Hans Jürgen. So this is to you, Gunnar, that welcome address. To all the panelists, how are you preparing for a recurrence in the fall and the annual flu season? Do you encourage or hold health and wellness fairs, which could include flu shots as well as other health monitoring? So anything specific on that area to each of you, starting with yourself, Nick?
We do compensate staff for the flu shot. We used to do it on site, and a couple of years ago we changed to just reimbursing staff for that. We've always focused on health and wellness. It was very important to our CEO from day one, with fitness points and fresh fruit and bringing in guest speakers at town halls. We've had to suspend some of that activity, of course. But one thing I didn't mention previously is that we've contracted a third-party health provider. And so we've taken the decision-making out of the hands of the supervisor, who may be conflicted with some productivity goals or on-time delivery goals. And so if an employee reports that they have any symptoms or fever, or their temperature reading exceeds the limit, then they're redirected to this third-party medical team. And that team continues with the diagnosis, asking questions and offering recommendations as to whether the employee should remain at home or go seek a COVID test. And I think as things get a little bit more tricky in the fall and the flu is confounded or with COVID and the symptoms are similar, having that medical team that understands our staff, having this routine in place that people are comfortable with, will help us navigate those challenges and differentiate the common flu from what could be potentially COVID symptoms. So on average, in any given week, we have 3 people who are away as precautions based on the medical advice of these companies. And throughout this, we've only had 1 reported case of COVID amongst our staff. But that's how we're proceeding, along with all the diligence items that I mentioned previously, to keep from getting COVID fatigue or crisis fatigue and prepare for the fall.
Thank you, Nick. Excellent. Thanks for sharing that. Chris.
So at this point in time, we're basically just following public health guidelines. You know, if you're sick, you stay home. If you have COVID symptoms, you phone the public health toll free line, and then if you get tested, you stay at home until results come in, and if you still have sickness, you quarantine for 10 days. So we're not doing anything other than following the public health guidelines at this point in time. But I do think that there's an opportunity for us to, like Nick mentioned, you know, to look at reimbursing employees for flu shots and looking at that as a further measure as we move into the fall.
Thank you, Chris. Gunnar.
So first of all, Maureen, thanks for the welcome, and I will send your regards to Hans Jürgen, but you have to tell me which one. I think I know 5 or 6 at least alone in this building. So sorry, but just let me know. I will send them. I think we do the same as Chris told, just following those rules, telling the people stay home if you feel sick. And right now we think about those flu shots as well, but nothing additional.
Okay, thank you. Thank you very much. So this final question does speak a little bit very close to what we've been talking about with the pandemic model. Is there anything in addition to what you've shared that would reduce or incorporate processes that would reduce employees home with the normal flu? Is there anything in addition to what you've already shared, and I'll just open it up to any one of you.
Sure, I could jump in. It's just a small point, but our company has revised its sick policy, and for factory workers, instead of it being used exclusively for sick time, we've added about 60% more time to our allotment and made it flex time so that employees could use it in half-day or full-day increments. And so we wanted people to be able to make the right decision and not be encumbered by financial constraints, so that if they were sick, they would stay home and not feel like they had to come to work to not miss any pay. Perhaps we could have done more with sick time, but we're also anticipating or waiting to hear what the federal government and the provincial government might mandate in terms of additional sick time. So we wanted to see how that played out before expanding the program any further.
Thank you, Nick. And this last question, looking at the time, but it's an important one. How do you support the mental health of employees and managers? Do you have services or consultants available to provide support and counseling to people? Maybe starting with you, Nick, what is your thoughts on that? Do you have any programs in place, or what is your protocol?
Yeah, through our insurance provider, we do have access for all of our staff as free psychological access. They can call a 24/7 hotline and convey their issues confidentially. We haven't expanded that program per se, not experiencing too much mental health increases since this in our population, but we've always relied on that benefit in that program, and that's served our employees well.
Gunnar, do you have any insight into this question?
Yes, I do. So we have an employee assistance program available to all employees. There's a 24 hours hotline they can call to get first support on just nearly everything. And there will be, so the health system in Germany is a little bit different. So they have access to all the doctors they need. If they need psychological help, they will get it from a doctor quite easy. But for this first questions, the first approach, they can call this hotline from the program. It's absolutely confidential, and it will take just a few more days to the first half-year report what happened there.
Okay, thank you, Gunnar. Chris, any final comments on that?
Can you hear me?
Yes, I can.
Okay, for us, we have a smaller workforce. We've got about 60 people. And so for us, we put a lot of emphasis on frontline supervisors observing workers. Mental health is obviously not just work related. It could be somebody having struggles with substance abuse or family issues or health problems. So we're just trying to keep an eye out for cues that would indicate that somebody might be struggling, and doing our best to work within our means to help those people get through what they are needing help with. And we have seen, an uptick in people that are struggling.
Thank you, Chris. Thank you all for your questions, and the audience. If we've missed yours, watch for the answers on our COVID-19 frequently asked questions page, or call us to talk with a safety advisor. Join us next Tuesday for our next webinar with Dr. Angela Eichelbosch from the BC Centre for Disease Control and Alliance ergonomist Dr. Era Potter on addressing the ergonomic impact of your COVID-19 controls in the design and retrofitting of your plant. Take our online COVID-19 safety assessment or call us to walk through your safety plan with an advisor. If you have other questions, please contact our health and safety support hotline or reach out to us through our website at any time. I want to thank all of you for joining us. Thank you once again, our panelists, for joining us today, and your responses really invaluable for our audience. Please also quickly share your feedback and suggestions in the brief survey in your inbox. We'll follow up soon with a wrap-up email that includes a recording of the webinar and links to the slides and related resources. Feel free to share these and follow us on social media for more news, resources, and future events. Thank you.